Well, we are joined now by United States Surgeon General and member of the White House Coronavirus Task Force, Jerome Adams. General Adams, thank you so much for being with us.
Great to be here.
Well, some have called the COVID outbreak an equalizer, affecting every class and creed. New data, though, paints a startling picture that shows Black Americans are at a higher risk.
Yes.
Why is that, and how do you address that in the middle of a crisis?
Well, thank you for that question. And this is something we've known all along. We've known that the impoverished, the folks who are disadvantaged, and communities of color have suffered disproportionately from diseases for as long as we've been recording the stats on diseases, whether it's heart disease, diabetes, lung disease. And unfortunately, we know that the risk factors that I just mentioned actually put you not just at higher risk for premature death before COVID, but they put you at higher risk of death from COVID-19. And so that's one of the reasons that minority communities are more at risk, because they are more likely to have these diseases, and it's why we need to address them specifically in those communities. But the other concern is that many people from a minority background, particularly African Americans and Latinos, live in multi-generational households. They can't social distance at home the way other folks can. And they work in jobs that pay hourly wages and don't allow you to telework. Many more of them work for the government. There are bus drivers, there are security guards. And so again, they can't telework, and they can't do the things that we know prevent this disease from spreading in terms of staying 6 feet away from other people, staying at home right now.
Well, we know not every jurisdiction is recording mortality by race, and you say that data collection is critically important in fighting the pandemic. Is the federal government pushing for every municipality to collect that information now?
We absolutely are, and we always have been. Again, one of the challenges is that this data has to make it from the local level all the way up to the federal government so we can look at it. So your coroner has to code a death directly. Your hospital worker who's busy dealing with someone who's actually dying has to actually code that correctly, or code that discharge diagnosis correctly. And so we're working with state, local, and federal partners to try to make sure we can collect that data and figure out where the problems are occurring. But the key point here is that people need to understand no one is immune to this disease, and communities of color are particularly at risk. That's why it's important, especially in those communities, that they follow these 30 days to slow the spread guidelines, including practicing good hygiene, avoiding large gatherings, and staying at home if you can. More critical in communities of color in the African American community than in even other communities.
Dr. Adams, I want to ask you about antibodies. I know there's a push for testing to determine how many Americans may be infected with coronavirus but asymptomatic. Why is that important, and when can we expect to see more of that kind of testing?
A great question again. We know that there is diagnostic testing, which means if you're sick or we think that you've been exposed, we want to find out right now so we can isolate you. There's surveillance testing, which is when we're just going out in the public and really testing people to find out, hey, you don't have any symptoms, but we want to make sure we understand what the rate of disease is in this community. And then there's antibody testing, which is looking backwards. It's saying, did you have the disease at some time in the past? That's important because it will allow us to put healthcare workers, frontline workers back to work, and put people in a position where they can be safe, because we know that once you have the disease, there's a 99% chance that you're immune and that you actually won't get it again. And so we would rather put you in an emergency room taking care of COVID patients if we know you've already got antibodies than if we feel that you may be susceptible to the disease.
Dr. Adams, the CDC has issued new guidance for essential workers who may have been exposed to COVID-19. What's included in the new guidelines?
Well, important for people to know that this is for essential workers, essential critical workers. And the challenge that we're dealing with is that when you look at the New York City data, 25% of their police force was out because they'd been exposed to someone who had COVID-19. And the previous recommendations were if you'd been exposed to someone, you needed to self-quarantine for 14 days. Well, what we said now, and this is based on the data, we had the CDC. It took us a while because we wanted to make sure we weren't putting people in danger. But if you take your temperature, if you wear a mask, if you practice social distancing at work, if you make sure you aren't sharing headsets or sharing food with other people at work, we feel like you can go back to work safely. And if you start to become symptomatic, you should go home immediately and call your healthcare provider. But that's the way to try to get our frontline workers back out there so that they can continue to support us as we're doing the right things by staying at home.
You yourself have said you see a light at the end of this tunnel. How should Americans move forward with that mindset when we know many places across the country still have yet to see their hardest hit days?
Well, good point. And every place is going to be on a different curve, but we now know what that curve looks like, and we know what we need to do to flatten the curve. Washington, California were the first to really focus on mitigation efforts aggressively and staying at home, and they have flattened their curve. New York and New Jersey, coincident with the time that they instituted stay-at-home recommendations, now are seeing their curve start to be flattened. And so we are optimistic. South Korea and China are reopening. Italy and Spain were hard hit, and they're on the downside of their curve. So we know that these things work if everyone cooperates with them. And we want people to know that New Orleans is going to hit their peak at a different time than New York. It's going to hit their peak at a different time than Washington or California. So it's important that we continue to test. It's important that we do the things that we know will flatten that curve whenever that peak hits.
In the fight against opioids, you partnered with faith communities. This, of course, is Holy Week. What are your recommendations on how people of faith can play a part in all of this?
I love that question. I myself am a Christian, grew up Catholic, and Holy Week is very special to me. And I remember going to church all throughout the week, and it's really tough not to be able to go this week, but I would tell people of faith, I don't think it's a coincidence that this is happening at this time. During this week, we celebrate the ultimate sacrifice that was made for us. God sent His only Son to die for us, and it was sad initially, but then we saw salvation at the end of it. It is very sad this week when we're seeing record numbers of people dying all across the country. People are sacrificing by staying at home. But the salvation at the end is that we are starting to flatten the curve. We are starting to see that these things actually are something that is working for us. And so I would tell people to stay the course. I would tell them to pray for each other. I would tell them to look out for their neighbors. Social distancing doesn't have to mean social disengagement. You can still call, you can still Skype, you can still FaceTime. As a matter of fact, now more than ever, it's important that we make sure our food pantries are full, that our support systems are actually still there, because we don't want people to be harmed by being isolated.
A little bit of a personal question for you. You're a physician, you're a father of 3, you're a husband, you've worn many hats throughout your career, and you've seen and treated many things. We know you're working around the clock, so personally, how are you holding up?
Well, thank you for that question, and I'm hanging in there. I worked at a level 1 trauma center for the last decade, so I'm used to doing 24, 36-hour shifts. But the thing is, usually you get to go home after the end of that and get some sleep. We've been working nonstop, and I would ask your viewers and your listeners to please pray for the public health workers. Please pray for the healthcare workers. Please pray for the public servants. Please pray for the grocery store workers and the delivery people out there who are actually putting their lives on the line and sacrificing so that you can stay at home, so that you can be healthy. And please pray for my family, because I signed up for this. I'm doing okay. But I've got a 15, a 14, and a 10-year-old at home. I have a wife at home who just finished cancer treatment. I understand how families in America are struggling to deal with this social distancing, to deal with the isolation that comes with staying at home. But we will get through this. There is a light at the end of the tunnel, and the more we focus on it now, the quicker this will be over.
U.S. Surgeon General Dr. Jerome Adams, we appreciate your time, and we appreciate you sharing with us. Thank you so much.
Thank you.